Understanding late-onset Alzheimer's disease. When Alzheimer's disease begins after age 65, it's considered late-onset Alzheimer's disease. It's the most common cause of late-onset dementia and is most often characterized by problems with short-term and long-term memory. Alzheimer's dementia stems from a buildup of toxic proteins in the brain that causes the death of nerve cells and interferes with communication between existing nerve cells. There's currently no cure for Alzheimer's disease, but there are treatments and lifestyle behaviors that may help slow its progression. What is late-onset Alzheimer's? Late-onset Alzheimer's disease is defined as Alzheimer's disease that develops when someone is 65 or older. Most people with Alzheimer's develop it after 65 years. The brain changes that lead to late-onset Alzheimer's start occurring years before the first symptoms appear. Alzheimer's disease that develops before 50 years or age is called early-onset Alzheimer's. Late-onset Alzheimer's disease is the same disease as early onset, and there's no clear risk factor or test that explains why some people start having symptoms later than others. What are the symptoms of late-onset Alzheimer's? Memory. As the disease progresses, memory problems can become more sudden. A person with late-onset Alzheimer's might ask a question that was just answered moments ago or repeat a story within a short amount of time. Sensory changes also start to take place. For example, someone with Alzheimer's disease may not be able to identify certain familiar scents or tastes. Recognizing faces and voices may become inconsistent. Personality. Later on, personality changes become more obvious. A person with advanced late-onset Alzheimer's may not recognize family members, or they may insist relatives or friends who have passed away are still alive. Emotions. It's also common for someone with advanced Alzheimer's to become easily agitated, anxious, or aggressive. Sometimes these changes are due to fear and frustration around their inability to remember certain people and events or understand what's going on around them. As the disease continues to affect an individual, thinking skills and mood, personality, and behavior changes often have causes not obvious to caregivers and those around them. What causes late-onset Alzheimer's? The primary causes of Alzheimer's disease, no matter when it develops, are buildups of two proteins in the brain, tau and beta amyloid. Known causes of Alzheimer's disease include tau and beta amyloid proteins. The protein tau forms tangles between brain cells, neurons, making communication and signaling between the cells more difficult and eventually impossible. The protein beta amyloid forms plaques or clumps within neurons, destroying the cells from within. Genetics. There also appears to be a genetic component to Alzheimer's disease. The condition tends to run in families, so if you have one first-degree relative with the disease, your chances of having it one day are increased. ApoE4 gene. Research suggests that a type of APO gene has the strongest influence on a person's risk of developing Alzheimer's disease. Everyone inherits some form of the gene, but the ApoE4 gene seems to have the biggest impact. It may be present in up to 65% of individuals with Alzheimer's disease, according to the Alzheimer's Association. What are complications of late-onset Alzheimer's? Late in the disease's course, complications that impact an individual's health develop, such as bladder and bowel control difficulties, chewing and swallowing, loss of interest and motivation to eat, malnourishment, pneumonia. How is late-onset Alzheimer's diagnosed? Tests that may be used to help diagnose Alzheimer's disease include cognitive testing. A person suspected of having Alzheimer's may be given a test of memory, problem solving, and language. Lab tests. Blood and urine tests are also ordered to rule out other possible explanations for changes in memory and thinking skills. Imaging scans. Imaging tests may be ordered to look for changes in the brain. Tests usually include computed tomography, CORT, scans, magnetic resonance imaging, MRI, positron emission tomography, PET scans. Is there a treatment for late-onset Alzheimer's? Medications. Galantamine, rivastigmine, and donepezil are cholinesterase inhibitors used to treat mild Alzheimer's. Two new medications, aducanumab and lecanemab, have recently been approved to treat Alzheimer's disease. They work by clearing beta amyloid plaques from the brain. They aren't considered cures, but they may at least slow cognitive decline associated with Alzheimer's disease for some people. Research into other drugs to treat the disease is going on around the world. Lifestyle changes for people with late-onset Alzheimer's disease, keeping as healthy a lifestyle as possible, including the following steps, may help delay worsening symptoms. Eating a balanced diet, engaging in cognitively stimulating activities, such as puzzles, crafts, and music, exercising regularly, getting regular social interaction, sleeping 7 to 9 hours a night. Can you prevent late-onset Alzheimer's? There's no known means of preventing late-onset Alzheimer's. It's not always clear why a person develops the disease. Health experts recommend people try to prevent other causes of brain changes by eating a brain-healthy diet such as the Mediterranean or MIND diets, getting sufficient sleep, limiting or avoiding alcohol consumption, managing blood sugar levels, managing stress, quitting smoking, if relevant, staying cognitively challenged through hobbies, social interaction, puzzles, and other activities, staying physically active,